another episode of Elite Medical School, and we're so glad to be back. As usual, it's the crew. What do you guys call yourselves?
Well, I'm Dr. Q, famous from Q Anon.
My name is Dr. PhD. I do no research of any kind.
Well, you've been studying your asshole a lot lately, right? You were saying that you sometimes just spend hours staring into it, just waxing philosophically.
I've actually been wondering what the evolutionary benefit of hair growing that close to the asshole is.
Well, it's the it's the reason it's there is to collect poo particles and to bundle up and get matted and
nice.
sort of form dreads. But anyhow, that's
I use mine to catch the nuts from my shit. They get caught up in there, and then I can just
plant them.
Plant them in my mouth.
Yeah, they're pre-fertilized. But you know what? Enough silliness. Let's get to the point. So today we're going to be talking a little bit about type 2 diabetes. One of the deadliest scourges that has afflicted North America for several decades now. The illness. This is something that you're going to encounter on the daily, I should say. And it's going to kill a lot of your patients. So we better figure out how to manage it appropriately. Do we want to start with a sort of basic definition of type 2 diabetes and what is perhaps diagnostic? Over to you, Dr. PhD.
Geez. Yeah. So in terms of at least, I guess the Canadian guidelines, fasting glucose, fasting glucose of over 7 millimoles per liter, or a 2-hour, 75-gram oral glucose tolerance test over 11.1 millimoles per liter, or just a random point glucose over 11.1, or HbA1c over 6.5 are kind of the criteria, I think, where they draw the beginning of diabetes. So if a patient has any one of those things that I listed, they qualify. So that's fasting over 7, oral glucose or random glucose over 11.1, or an HbA1c over 6.5%.
Mm-hmm. On 2 occasions. And they don't specify how far apart those have to be, but it is relevant to billing for the A1C. But yeah, so that's your lab definition. And more generally speaking, diabetes is really a metabolic disorder, obviously characterized by hyperglycemia primarily, but also changes in body weight and defective insulin action and probably more generally insulin insensitivity. So I think that's a good functional definition of type 2 diabetes.
Dr. Dre, now when you do the taste test of the urine, do you do that twice for billing as well?
For billing purposes strictly, yeah. It's an acquired taste. It hasn't made its way into Diabetes Canada guidelines, but it's sort of an ancillary test to confirm your suspicion of diabetes.
Nice.
But
personally, I prefer Gamer Girl P.
Gamer Girl P, yep.
Yeah, Gamer Girl P over birthday cake P.
The other, it's actually a way you can distinguish between type 1 and type 2 diabetes is that the urine from a type 1 diabetic tends to be more sort of fruity because of the ketones, whereas type 2 diabetics tend not to have ketones in their urine. So it's a little known fact. And yeah, this is a test that goes back to Galen. So we continue in his proud legacy of urine tasting.
Yum.
So yeah, I think those are good sort of that's a general definition and the primary diagnostic criteria. Shall we discuss some risk factors for developing type 2 diabetes?
Yeah, sure. So some risk factors that you would want to remember for the exam, if they ask you to list them off, you would want to, so age is one of them. Anybody over 40 years old, that's a risk factor. First degree relative with type 2 diabetes, so you want to get that family history. Uh,
Trivia alert. What is more heritable? That is, what has greater concordance? Type 2 diabetes or type 1 diabetes?
Type 2, you nerd.
Yeah, by a long ways. Continue.
Members of high-risk populations, such as those that are Hispanic, Aboriginal, South Asian, Asian, or African descent. That's a risk factor. History of prediabetes. Duh. Presence of complications associated with diabetes. So, one thing that we can mention with the diagnostic criteria is if there are presence of hyperglycemic symptoms like polyuria or polydipsia or blurry vision, polyphagia, then a confirmatory test may not strictly be required. Other risk factors, we've got micro or macrovascular disease, specifically referring to coronary or cerebrovascular peripheral disease. History of gestational diabetes, history of delivery of a macrosomic infant, presence of vascular risk factors, use of medications that may be associated with that are associated with diabetes, which include things like antipsychotics and corticosteroids.
Boom, there goes the dynamite.
Pretty thorough.
Wait, did you mention obesity?
No.
Yes. I would wager that elevated body weight is the number one, maybe next to family history would be the number one predictor of type 2 diabetes.
All right, that's a
Um,
microaggression, dude.
so, well, actually, it's a macroaggression.
Woo!
That's very helpful, and importantly, in all seriousness, when you have diverse patients, definitely consider, in some of your younger patients as well, the development of diabetes. So it is surprising that you especially in obese folks of high risk ethnicities, that there can be trends toward diabetes at young age. So yeah, the Canadian guidelines, for example, would recommend for the average population not to screen before the age of 40. But if there was sort of a cluster of these risk factors, you might screen sooner. And you can see type 2 diabetes or movement toward type 2 diabetes even in folks in their 20s or earlier. So that was helpful, very helpful indeed. If we don't identify them with screening, how might these folks present to your clinic? What are some initial symptoms of diabetes, type 2 diabetes that had been undiagnosed?
Yeah, I think Dr. Q kind of touched on that with the like polyuria, polyphagia, dehydration. You could have other sequelae such as microvascular complications, looking at things like peripheral neuropathies. You could have like coronary artery symptoms. Obviously if you have anything like a stroke or an MI or something like that, or peripheral artery disease or claudication, those are all highly correlated or could be an indication of poorly controlled diabetes, but that have to be going for quite a while before you develop those.